We are so blessed and thankful for once again you given us this wonderful Sabbath day. May you sing with us as we sing scripture song to give praises to your holy name. Thank you, Lord, for your love, for you are always there for us. In Jesus' name, amen. To start our worship, we will sing scripture song. The first song is Genesis 2, 2, and 3. Genesis 2, 2, and 3. If you have your King James Bible, then that will be the lyrics of the song. John 5:14. And this is the confidence that we have in Him, that if we ask anything according to His will. 1 John 5:14 and 15. And this is the confidence that we have in Him, that if we ask anything according to His will, He hear it us. He hear it us if we ask anything according to His will. And if we know that He hear us, whatsoever we ask, we know that we have the petitions that we desire of Him. And this is the confidence that we have in Him, that if we ask anything according to His will, He hear it us. 1 John 5:14. If we ask anything according to His will. Before we sing our opening song, we will hear first the instrumental number that will be given by Brother Gian Angelino. To continue our worship, we will all rise and we will sing our theme song, I Will Go. We have been called to follow Christ. We are to preach, we are to teach, we are to fight. So where you lead me, I will go. Touch my heart, where you stand, I will go. I will go, I will go. Who will go for us? I will go. I will go, I will go. Here am I, send me, Lord, I will go. My eyes have seen the King. I must let all the world worship Him. In all the nation, in all the world, by His strength, yes, I will go. I will go where you lead me. I will go where you lead me. Who will go for us? I will go. I will go where you lead me. I will go where you lead me. Here am I. Send me, Lord. I will go. I will go where you lead me. I will go where you lead me. Who will go for us? I will go. I will go where you lead me. I will go where you lead me. Here am I. Send me, Lord. I will go. I will go.
At this moment, I invite everybody to bow your heads for prayer. Our dear Heavenly Father, we give you thanks once again for this beautiful and blessed Sabbath that you have gifted to us. Thank you, Lord, because you have given us the opportunity to come and to worship together with the beautiful people of Naga. And now, as we dive deeper into the message for this afternoon, we ask you, Lord, to bless this message and allow us to be able to understand it and to be able to apply it as well. And in your precious and holy name we pray. Amen.
The Sabbath. Keep my Sabbath holy, that they may be a sign between us. Then you will know that I am the Lord your God. The Sabbath will be a sign between me and the Israelites forever. For in 6 days the Lord made the heaven and the earth, and on the seventh day He abstained from work and rested. As the new heaven and the new earth that I will endure before me, declares the Lord, so will your name and descendants endure. A blessed Sabbath afternoon, everyone. On behalf of the AY department, we would like to warmly welcome you all for attending our afternoon worship. And we would like to congratulate you for coming on our worship this afternoon. Thank you for setting aside our personal nap just to worship with God. And I know that God is happy, and we are all happy that we are here this afternoon. And especially to our dear visitors from Loma Linda University, we are so glad that you are here worshiping with us. And we would like to thank you for the lecture and the insight that we are going to learn this afternoon from the lectures that we are going to hear. We would like to thank Brother Gian Angelino for giving the instrumental number, and Brother Kevin Gonzalez for rendering the prayer. After my remarks, we will hear a musical offering from Brother Eugene and Company, And after that, we will hear a lecture or inspirational message from the former president of our school, Dr. Elias Cam. And after that, we will hear an instrumental number from Brother JJ Arizabal. And we will hear a lecture from Dr. Timmy Lola G. Jedi. Ayan. And we will have a Bible icebreaker to be led by Ma'am Margel D. Melias, and a musical offering to be given by Brother Chad Napod and company, and another lecture from Dr. Norin Chan Tompkins. And after the lecture, we will have a question and answer portion. That's why please prepare your question if you have any question, so that we will have an interaction with our visitor. And the closing prayer will be given by Brother Richard Gonzalez. I hope that we will continue to feel the presence of God as we worship Him this afternoon. Thank you and God bless. I will now give the time to Brother Eugene and company.
keep on letting you down. And each time I will fall short of your glory, a part of forgiveness abound. And you answer, my child, I love you. And as long as you're seeking my face, you walk in the path of my daily sufficient grace. Times I may go weak and feel a bit discouraged, knowing that someone somewhere will do a better job. For who am I to serve you? I know I don't deserve you, and that's the part that burns in my heart and keeps me hanging on. I keep on letting you down. And each time I will fall short of your glory, how far of forgiveness abound. And you answer, my child, I love you. And as long as you're seeking my face, you'll walk in the path of my daily sufficient grace. You are so patient with me, Lord. I keep on letting you down. Each time I will fall short of your glory, a part of forgiveness abound. And as long as you seek in my face, of my daily sufficient. You pick me up, and I keep on letting you down. And each time I will fall short of your glory, a far of forgiveness abound. And you answer, my child, I love you. And as long as you're seeking my face,
Good afternoon, everyone. Shabbat Shalom. May the peace and blessings that this special day brings be yours and also be mine. Shabbat Shalom. Maayong adlaw sa inyong tanan. I understand there are more Visayans now than Bicolanos and than Tagalog Sir at Nagabyo. Mayong adlaw sa inyong tanan. Okay, may we recognize our guest? I'm not one of them. It was because of the initiative of Loma Linda University, because of their Student for International Mission Service, that the three of us are here. Loma Linda, ADRA Philippines, and Nagabyo Adventist Academy for the first time are together, and God brought us together. But it was the initiative of Loma Linda University because of their program called Students for International Mission Service. Let's give them a hand. Sila po ang mastermind nito, naimbita lang kami. When I say kami, kasama po ako sa ADRA Philippines. Okay, ang inyo pong kausap ay once upon a time galing dito. But, one day, I was called to the office of the country director of ADRA Philippines and she told me, Dr. Cam, I cannot join you, so you better go. Kaya si Dr. Cam because she cannot come, I had to go. Kaya kasama po ako ng grupo nila. Right now, I'm working with ADRA Philippines as its church relation officer. Kaya nakikita niya akong pumupunta dito because of ADRA. At siyempre, kung hindi nyo alam, there was, in February, there was a verbal agreement between ADRA Philippines and Nagabio Adventist College that there should be a linkage, some kind of linkage, kasi hindi pa nagkapirmahan yata, that there should be a relationship built already between ADRA and Nagabio. So, as a matter of fact, 10 of you, 1 teacher and 9 students will be joining us in Gainsa Sunday and Monday, and on Wednesday, those 10 Nagabio people will be with us. Prueba ba yan na umaandar na yung memorandum of agreement? So, the 3 of us will be working together. Now, gusto ko lang pong, because there will be 2 lectures, so I better do this fast. Actually, I should have spoken during the hour of worship, borrowing the script, borrowing the sermon of our country director. Our country director, for the first time, sa mahigit na 40 anyos ng ADRA Philippines sa Pilipinas, for more than 40 years, mga 42, 43 na yata, kauna-una for the first time, there's a Filipina who is now the country director. She's the one directing the affairs of ADRA here in the country. And she was the vice president of Mountain View College before she joined IAS. Before she joined ADRA. So ngayon, I just would like to make it very clear. Because you see, I should not take too much of the time for LLU. Let's give them the time. So just give me a few more minutes. I just wanted to explain, because whether you know it or not, ADRA is misunderstood. In fact, one said from America, one said, Eli, ang ADRA ay parang independent ministry. Independent ministry? No. In 1966, ADRA was already existing, but with a different name. Supported by our tithe and offering, it was the Seventh-day Adventist Welfare Service. In 1966, but in 1984, that was the time when funds were coming from everywhere, that SOS became ADRA. Adventist Development. Please, not disaster. Some say ADRA is Adventist Disaster and Relief Agency. No, it should be ADRA what? Development. ADRA is Adventist. Sabihin nyo nga po. A is Adventist. D is Development. R is? A is? Okay, ADRA is Adventist Development and Relief Agency. So, isa pa, one commented, ADRA is not Adventist. It is a United Nations institution. Wrong. No, that's not true. Although the truth is, ADRA is recognized by the United Nations. And ADRA is present in 120 countries in the whole world. What is the purpose of ADRA? So that people, humanity, may live the way God intended them to live. And that's our job. Okay, I can say more. And by the way, in the Philippines, ADRA became a byword, meaning if there's typhoon, if there's earthquake, if there's fire, if there are disasters, ADRA is always there. To the point that our mentality is ADRA is always there to give. I'm here to tell you have to change that mentality. This is now the time, especially what happened in the US last January 20. This is now the time for all Seventh-day Adventists in the Philippines to help ADRA so that ADRA can achieve its goal to help people. So we help ADRA now so that more people can be helped. Instead of asking, even Adventists are asking, what can we get from ADRA? Let's help ADRA so that many more people can be helped. By the way, so what I'm saying is, ADRA is not for relief purposes only. There are 4 others. We have to think of risk reduction because of this climate change that's happening. There is education, there is livelihood, and what? Health. And that's part of what we will be doing together. We are into health, we are into education, we are into livelihood, disaster and relief operation, and disaster reduction. So with this, ladies and gentlemen, brothers and sisters, I promise you, with the approval of Nagabio, we will come back. And perhaps one of these days, after the General Conference session, with our country director. By the way, she's Dr. Hope Aperocho. We will request you to hold a special Sabbath one within the year, and let's call it ADRA Sabbath, so that it means we take over during the Sabbath school, our worship, and also like this in the afternoon. One of these days, hopefully it will come. May God bless you all, and please open your ears very well. There will be two great lecturers from Loma Linda University. This health lecture, we should have even invited brethren from the neighborhood. But anyway, if there are still students out there, call them. They'll be missing a lot. Okay, thank you for listening, and please pray for ADRA. Please pray for our guests, for our mission, medical mission, tomorrow, Tuesday, and on Wednesday. God bless you all. Shabbat Shalom.
All right. Hi, good afternoon, and happy Sabbath. Yes. It's a wonderful privilege to be here with you this afternoon, and I just want to thank Naga View Adventist College for allowing me this opportunity to share some views and thoughts about mental health. If we can get it up a little bit. Okay. So I'll start until they can get it up. So we're going to discuss this afternoon about, it's on. Okay. We're going to discuss this afternoon about mental health, a topic that is very dear to my heart. And while it is a very sensitive topic, it's important in the day that we live in today. So just again, we're going to discuss about mental health. And while it is a very sensitive topic, it is important to discuss in the world that we live in today. So I'm going to ask you a few questions just to get your mind thinking. When was the last time you thought about your mental health? And when was the last time that you thought about the mental health of those around you? About a year ago, I took a course to become a certified mental health first aider. This opportunity was basically a program that teaches adults how to recognize and respond to someone experiencing a mental health challenge. 3 things that was important in this program was to identify signs and symptoms, listen non-judgmentally, and also give reassurance to somebody who is experiencing mental health. As a mental health first aider, we do not diagnose nor treat a mental health challenge. Rather, we help to refer a person to appropriate professional support and services. So my hope today, as we discuss, we'll talk about a little bit of the overview for this discussion. We're going to highlight important mental health statistics, differentiate between mental health versus mental illness/disorder, briefly discuss types of different mental health disorders, and discuss some protective and risk factors that determine mental health. And last but not least, we'll discuss ways to better mental health by treatment and support. So in 2019, 970 million people globally were living with a mental health disorder. Something to take into consideration is that this was pre-COVID. So imagine how this number will be so much more significant if we're discussing post-COVID times. The prevalence of different mental disorders vary with gender and also with age. About 1 in 8 people in the world live with a mental health disorder. In both males and females, the most common mental disorder is anxiety and depression. People with severe mental health conditions die 10 to 20 years earlier than the general population. Also, economic consequences of mental health conditions leads to productivity losses and other indirect costs to society, which are very enormous. So I read an analysis in the Philippines that calculated that in 2019, they basically looked at 6 different mental disorders, and they saw that it cost the national economy about $1.3 billion. So this can be from lost productivity capacity, from premature death, from disability, and also from reduced productivity while at work. So we can see how this can take a toll on the community as well. Several factors stop people from seeking help. Mental health has so many stigmas associated with it. And so a lot of people do not seek help for many reasons, including poor quality of services, low levels of health literacy, and also stigma and discrimination. So unfortunately, many people suffer in silence. So as we continue our discussion, it's important to define what exactly mental health is. According to the World Health Organization, mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well, and work well, and contribute to their community. So like physical health, everyone has mental health. However, many people do not realize this, that our mental health is just as important as our physical health. So, taking care of our mental health is important for every stage of life. First and foremost, for those who are in their early and middle childhood, they're reaching developmental and emotional milestones. At this age, they're learning how to share, how to make friends, and deal with the problems that are difficult to understand and navigate. As we move on to adolescence, in this age group, they're exposed to different challenges such as poverty and sometimes violence, and that makes them vulnerable to mental health problems. And for this group, I know there's a lot of young adults amongst us, and positive mental health can really help during this time of transitioning. So there are many who are entering college, there are many who are starting new jobs, or even starting a new family. Next is middle adulthood. And this leads to many dealing with different life stressors like jobs, parenting little ones, taking care of their parents, while all juggling different relationships. And last but not least, the elderly. The elderly also deal with different life changes, such as retirement, serious illnesses, and loss of a loved one. All these can impact their mental health. So mental health pertains to every stage of life. So next we're going to talk about mental illness/disorder. The Centers of Disease Control and Prevention, the CDC, states that mental disorders are conditions that affect a person's thinking, feeling, mood, or behavior, and this can affect their ability to function and relate to others. And according to this, they say that when a mental health problem is considered severe, it is called a serious mental illness. So take, for example, if a person can experience one event, that one event can have a lifetime impact on their overall well-being. Now imagine this one experience happening over and over and over again. All these series of events can have a cumulative impact. And while many are resilient, people, when exposed to adverse circumstances, including poverty, violence, disability, and inequality, this puts them at a higher risk of developing a mental health disorder. So this is just showing you that mental health is a dual continuum. So at the top, you have optimal mental health. At the bottom, poor mental health. And from the left and right, severe mental illness and no mental illness. So all of us are striving to have positive mental health. And what does that look like? Ability to learn, express, and manage a variety of emotions, form good relationships with others, and also to cope with the change and uncertainty of life. So this is optimal. However, there are those that deal with poor mental health. So if you look at the far left quadrant, you'll see that it's possible to have a severe mental illness, but still have optimal mental health. So take, for example, somebody with depression. They're on the correct treatment, they have support from their relatives and family, and they're able to understand their abilities and limitations and cope with their daily stress. So this kind of individual who has depression can still have optimal mental health. On the contrast, somebody that doesn't have any mental illness can actually have poor mental health. So while they might not have depression or anxiety or any of the mental illness that we'll discuss a little bit in the future, all in all, they don't have the right coping mechanisms to deal with the stresses of life. So as you can see, optimal mental health doesn't necessarily mean absence of mental illness. So next we're going to discuss some types of mental illnesses. These are just descriptions, not so much criteria for diagnoses. So there are different types of mental illness, the first being mood disorders. And this can be elevation or lowering of a person's mood. Examples would be depression, bipolar disorder, seasonal affective disorder, while others deal with anxiety disorders, which are intense worry about future events. And this goes further. It's not just worrying about what tomorrow will bring. These type of thoughts disrupt the person's ability to perform at work, school, or even to have relationships. And these examples would be like generalized anxiety disorder or social anxiety disorder. Some individuals deal with personality disorders. So this can be ways of thinking, feeling, or behaving that are markedly different from the accepted norms. So examples of these would be like borderline, narcissistic, or antisocial or paranoid personality disorder. Next we have is psychotic. And this can be severe mental disorders featuring abnormal thinking and perceptions. So these we consider severe, such as schizophrenia or schizoaffective disorders. There are individuals that have serious illnesses tied to irregular eating habits, severe stress, and concerns about their body image. So these we will characterize as eating disorders. And examples of these are anorexia and also orthorexia nervosa. There are individuals who have a traumatic or stressful event in their lives. And these we characterize as trauma-related disorders. Examples of these would be like post-traumatic stress disorder or acute stress disorder. And lastly, there are those who have recurrent use of substance abuse, and this can lead to impairment. So these are substance use disorders, such as alcohol use or opioid use. So mental health can be determined through different factors. And individual, family, community, and also structural factors can impact mental health. All of these can either have a protective factor, which can enhance mental health, or risk factors, which can undermine mental health. So let's talk about the first one, which is individual factors. This relates to somebody's intrinsic or learned abilities and habits of dealing with emotions and engaging in relationships, activities, and responsibilities. Next, we have family and community factors. And these can be the place where the person lives, their immediate surroundings, their opportunities to engage with partners and family, and also engage in meaningful activity. And lastly, structural factors. And these are dealing with a person's social, cultural, geopolitical, and environmental surroundings. So we're going to go a little bit more into depth into these three factors, just to understand it a little bit better. So first we're going to talk about some individual determinants. So protective, once again, are factors that enhance mental health. So these can be genetic factors, a sense of self-worth, understanding that, okay, I have an identity and I'm worthy to be loved, I'm worthy to be cared for. Good physical health, and also social and emotional skills. On the other side, we talk about risk factors for the individual, such as genetic factors, once again. So this can be a mother who was using substance abuse, using substances while pregnant, and this can affect the child as they grow up. alcohol or drug use, eating unhealthily, chronic diseases, and also body dissatisfaction. Family and community factors can also affect a person's mental health. So some of protective factors can be good perinatal nutrition, so a mother giving breast milk, a mother making sure that our children is eating healthy food, and also good parenting, so being nurturing and supportive to your children. Physical security and safety, knowing that you have a safe home to go to, and also positive social networks. Like, for example, being here in church, having friends and family that support and encourage you when you're going through a tough time. However, not everyone is disposed or predisposed to these positive environments. There are those that have risk factors, such as sexual abuse and violence, emotional or physical abuse in the home, or sudden loss of a loved one, and also job loss. So all these things can actually undermine mental health. During my study, I found that bullying has been identified as the leading risk factor for mental health problems in adolescence. Next, we're going to talk about some structural determinants. So some protective structural determinants are income and social protection. Knowing that when you go to your job, you're going to get a paycheck, you have good coworkers that support you, and also equal access to services. So access to basic services such as food, water, shelter, health, all these things can help to enhance your mental health. Economic security and also quality natural environment. So being out in nature, making sure that your home is somewhere that helps you to feel better. So, the sun is constantly shining. All these things in the natural environment enhances our mental health. However, there are some that deal with some risk factors in their structural determinants. For example, poor access to services, injustice, discrimination, and social exclusion, and also the climate crisis or pollution. So exposure to air pollution is likely to adversely affect our mental health, affect our brain, and increases the risk and duration of mental health. In addition to this, racism or discrimination within a particular group in society can increase your risk for mental health. Next, we're going to talk about some myths and misunderstandings that are dealing with mental health. So once again, these are things that are not true. But because of the way that we perceive mental health, a lot of people begin to understand these and believe them, and as a result, they do not seek help. So first myth is that people can use their willpower to pull themselves out of a mental health or substance abuse disorder, and that's just not true. There's another myth that only weak people have mental disorders. Even the strong can go through situations that can affect their mental health and can lead to having mental disorder. It's better to avoid psychiatric and medical treatment. No, as we'll learn in a little bit, it's important to seek treatment and it's important to seek help when needed. And last but not least, people with mental disorders are dangerous. So all these are myths that we will try to combat and can really prevent people from getting help when they need it. So next we're going to talk about some treatment and support. The first thing is medical treatment. So individuals can be placed on antidepressants, antipsychotics, and also mood stabilizers. And pharmacists, just like myself, play a major role in these. So we can provide support by reviewing the patient's medications, providing counseling, especially what to expect when patients are on medications, the expected medication response, drug interactions, and possible side effects that a patient may have. And pharmacists can also share lifestyle changes, such as improving sleep hygiene and some relaxation techniques that you can use. There's also psychological treatment. So we always encourage our patients to get counsel with a psychiatrist, a social worker, or a psychologist, or a substance use professional. And it's been shown that all these psychological treatments can help to reduce symptoms, it can improve life skills, and reduce problem behavior such as drinking too much, alcohol, and some other substance abuse or disorders. And all these therapies, whether medical or psychological treatments, can happen one-on-one, in a group, or with a community. Last but not least is other support. So if you're here listening to this presentation, you can help someone dealing with a mental health disorder. So friends, sibling, neighbors, and religious leaders can help someone who is dealing with a mental health disorder. And how can they help? They can watch out for early signs. So if an individual is eating or sleeping too much, feeling helpless or hopeless, or having severe mood swings, or pulling away from people when they usually engage in activities, all these are signs that this individual may be in the beginning of having a mental health disorder. Next is programs. There are mentoring programs that a person can engage in, some peer support groups that can help them to deal with their mental health disorders, and also activities. So we know that exercising and releases endorphins. So all these things can help you to have better mental health and to also feel better. Engaging in sports, art, music, hiking, and volunteering. So some things that we are here to do is to volunteer and to be part of a mission trip. When we decide to take the focus off ourselves and help somebody else, it actually improves our mental health. So helping others can also help through volunteering. So before we talked about a little bit about the myths and the stigma that was associated with mental health. So I want to leave us on a positive note that recovery is possible. So for most countries and communities, unfortunately, mental health conditions continue to have a heavy toll on people's lives, while mental health systems and services remain ill-equipped to meet people's needs. But I still say that recovery is possible. So research has found that there are 4 major dimensions that support recovery. The first is health. So overcoming or managing one's disease or symptoms, making informed, healthy choices that support your physical and emotional being is very crucial. Next is home. Having a stable place to live is something that is important towards recovery. The next is purpose. Conducting meaningful daily activities and having the independence to get income and resources to participate in society. And lastly, community. Having relationships and social networks to provide friendship, love, and hope. And that's why having a church community, having family that support you, all these are possible and can help an individual with mental health seek recovery. So last but not least, I just want to share that God cares about our mental health. It's so funny that the Sabbath school that we had today, the memory verse was actually the one I'm going to share right now, which is 2 Timothy 1:7. For God has not given us a spirit of fear, but of power and love and of a sound mind. And so God cares about us having a sound mind, and He cares about our mental health. So if there's anything that you take away from this presentation, is to make your mental health a priority. So these are my references, and I thank you so much to listening to my thoughts about mental health. Thank you.
Hello. And happy Sabbath, everyone. For our Bible icebreaker, we will have a short and simple activity. You will be divided into different groups. This part will be the group 1. Then group 2 from Veronica to Jody's bench. Yes, you are group 2. And from Brother Nestor to the back, that's group 3. Group 4, from this bench to Ma'am Nayumi, you are group 4. Then Rowie to the back is group 5. Then group 6 is from Samuel to, yes, from that bench. You are group 7. And group 8 is from Camille's bench to the back. Okay, that's group 1, 2, 3, 4, 5, 6, and 7. So here's the activity. We are going to just guess the phrase. We will be showing you a picture here, and you will guess the phrase that it illustrates. Okay, we will have an example here. Where is Ma'am Nikki? Ma'am Nikki, for example, you will be the one who will guess the first picture. Yes. Okay. I will be calling the group. You will stand up and you will guess the word. You're not going to guess everyone at the same time. Okay. Ma'am Nikki, please stand up. Guess the Bible phrase. Okay. Paki-on.
Beginning was the Word, and the Word was with God, and the Word was God.
Okay? Yes, correct. Ayan, so that's it. Ganun lang siya. That's very simple. Okay, let us have the group 1. Please stand up. Group 1, sama-sama kayo. You will help each other guess the picture that we will be showing you. Please stand up, group 1. Okay, for your guess the picture, we have guess the Bible phrase. Group 1? Yes? Your answer is? Time. Po?
Ano tawag sa...
Creation time? No? Yes, Kuya Ronel?
Time of creation.
No? Time, yes. But what kind of time? From the other group who wants to help. Yes, we have from the group 6. 6, right? Okay. Group 6. What does the picture says? Please stand up. It's okay if it's just a short phrase. Just the, yes.
A time for every season, a time to laugh and a time to cry. And
Yes, there is always there's a time for every season. Thank you, group 6. And next, let us have the group 2. Group 2, please stand up. Group 2, Veronica to Jody. Ayan. Pwede kayong pumunta doon sa may part nila para sama-sama kayo, magtulong-tulong. Yes. So here's your picture. Group 2. Group 2. What does the picture says?
You are the salt of the world. Parang
You again?
you are the salt of the world.
You are the salt of the world or of the earth. Correct. Thank you po for that. Next, group 3, please stand. Here's your picture. Group 3, from Brother Nestor to the boys at the back. Yes. What does the picture says? Dun kayo. Yes.
Money is the root of all evil. Money is the root of the all.
Okay. Love of money is the root of evil. Yes, thank you. Correct. Thank you po. Next, we have the group 4. Group 4, please stand up. Pwede po kayong mag-move para medyo malapit po kayo sa isa't isa. Yes. Yes. Please stand up, group 4. This is your picture. What does the picture says? Anyone? This is what?
Basta iPhone na
Yes, it says. Yan lang siya, yan lang.
Eye for an eye, tooth for tooth.
Okay, eye for an eye. Thank you po. Please sit down, group 4. Yes, eye for an eye. Next, let us have the group 5. Group 5, please stand up. Oh, Christopher, hindi ka sasagot, ha? Okay, group 5, here's your picture. Walang magaan. No coaching, Christopher. What does the picture says? Upper room. Yes, that is upper room. Thank you. Next, let us have the group 6. Group 6. Yes, please stand up. Here is your picture to guess. What does the picture says? Anyone who wants to guess? Yes?
5 loaves, 2 fishes.
Yes, 5 loaves and 2 fishes. Yes. And next, group 7, please stand up. Here is your picture to guess. What does the picture says? Yes. What? Born again. Yes. Thank you. We still have here few pictures. Anyone who wants to guess? This one. Anyone? Yes po, Ma'am Paes.
Oh, be careful, little eyes.
Oh, be careful, little eyes. Other answer, yes.
Turn your eyes to Jesus.
Yes, turn your eyes upon Jesus. Next. Anyone who wants to answer? Yes, Marks. Huh? Wolf in the sheep's clothing. Yes. Yeah. And the last but not the least, everyone please stand up. Lahat po tayo mag-guess po nitong picture. From group 1 to group 7. Guess the word only. Everyone say it again. Amen. Thank you everyone for your participation.
Okay.
Chad, say something. Wait, Chad, it's on now.
Hello?
Oh.
Kamusta ka? Happy Sabbath, everyone. We're going to be singing Goodness of God.
Yeah, we can do a semicircle. Semicircle. Does everyone see that?
I love you, Lord. Oh, your mercy
my life. God, your goodness. Sing your goodness. Your goodness is running after. It's running after me. Your goodness is running after. It's running after me. With my life laid down, I surrender now. Lord, I give you everything. Your goodness is running after. It's running after me. 'Cause all my life you have been faithful. 'Cause all my life you have been so, so good. With every breath that I am able, Lord, I will sing of the goodness of God. Sing all my life. All my life you have been faithful. Sing it out all my life. All my life you have been so, so good. With every breath that I am made, oh, I will sing of the goodness of God. Oh, I will sing of the goodness of God.
All right, isn't God so good? He's so good to us all the time. So I'm Dr. Noreen Chan Tompkins, and I'm going to speak to you about sparking your superpower and becoming a healer, an innovator, and a caregiver. So, have you ever wondered what does it mean to be in healthcare? We often think of the hospital area as being the primary area for healthcare, but really it encompasses the hospital setting and also so many areas in the community. And it primarily encompasses making a difference in people's lives. So what I want to cover today is I want to discuss different kinds of healthcare careers that can be personally rewarding and impactful to not only your life, but also to serving others. We don't have time to focus on all the different professions, but I will try to at least hit highlights of different roles for physicians, nursing, dentists, social worker, occupational therapists, physical therapists, and pharmacists. Since I'm a pharmacist, we'll focus a lot on that towards the end, but I want to highlight basic concepts. So, as I mentioned, we think of why is healthcare so important. It really can make a big difference in people's lives because you're constantly not only discovering new medications, but you're also discovering new ways to treat patients through innovation. And there are a lot of different roles that are what we call interprofessional. So you are not only counting on yourself as one profession, but you're counting on all the other professions to help each other through teamwork. And you can build on that to create a strong future for the healthcare profession. So let's start where the heart of healthcare is. The most common healthcare workers we start off is your physicians and your nurses and dentists. So starting off with the physicians, they really are key to playing detective. They are the people that really unlock the body's mystery because they have to put their thinking caps on and really think about what on earth is going on with the patient. They follow a concept we call the CLEAR model for whole person care at Loma Linda University Health, where C is for connecting and connecting with God, L for listening to your patients, E for having empathy, A for acknowledging your discussions with your patients and listening to them, and then R for responding to what their needs are. So by diagnosing and prescribing the treatments, the physicians are following the CLEAR model. They might perform surgeries or they might even do clinics to follow the patients for a long, long time. And they can make a big impact by leading the healthcare team and making those very, very important decisions. The image on here is showing a healthy kidney that's on the left-hand side versus an infected kidney on the right-hand side. You can see it's a little bit more swollen. So the doctors that specialize in reading these imagings will help all the clinicians fine-tune what is going on with the patient. Not only do physicians do primary care, but they can specialize in every single part of the body. And these are just examples where there's maybe a cardiologist that needs to look at the heart doctor, and that's the image on the left, top left screen is an EKG. It's a measurement of the heart. And depending on how those waves or those lines are going, will help the doctor determine how good the heart is functioning. The very top could be a surgeon's perspective. These where they might do general surgery on the stomach or the abdomen area, or they might be an orthopedic surgeon where they might do bone infections and things of that nature. And then, of course, there's cancer doctors and then pediatricians that see just kids. So let's switch gears to nurses. Nurses are so instrumental in helping caring for the patients because they are at the patient's bedside 24/7 when they're in the hospital. They have a lot of compassionate care in action every single day and every single hour with the patient. They help give the medications to the patients, and they take their vital signs. So they take their blood pressure, they take their heart rate, they take their respiration rate, how fast are they breathing, and so forth. And they will reach out to the physician if they have any concerns on what's going on at the bedside. And they really serve as an advocate for the patient, and then ultimately provide them with comfort. Not only are there bedside nurses, but there are nurses that can specialize in different areas of the hospital. We've got your emergency room nurses or urgent care nurses that they have to work in very, very fast-paced environments because things can happen very, very quickly with accidents coming in to the hospital, and they needed to get them to the operating room really quick and so forth. Versus in the labor and delivery, that's when new little babies are born, and it's very exciting for them to be able to not only welcome the little new baby, but also congratulate the parents when they have their newborn. And then very much like the emergency room nurses, the critical care or the intensive care unit are the sickest of the sick. These patients are very, very sick that they often might need to be on breathing machines. They might need to be on much more specialized support beyond what is normally seen throughout the rest of the hospital. And then we've got pediatric nurses too. They love to play with kids, and that's always a fun thing. So what about dentistry and dental hygienists? This is very, very crucial for making sure that people maintain good oral hygiene so that you will be able to eat your food, you will be able to talk easily, and so forth. And not only does it build healthy eating habits, but it also builds your confidence based on the appearance and the cleanliness and hygiene of your teeth. So routine visits to the dentist and dental hygiene is very much recommended. But beyond that, if there are other special needs for your teeth, say you have a lot of crooked teeth, the orthodontist can help use some special braces, or sometimes they're using some Invisalign molding of the top and bottom of the teeth now, that they will straighten the teeth over the course of a year or so, depending on how much they need to move. So on the silver metal are the braces on the left, and you can see how much it's straightened out. There also are dentists that specialize called prosthodontists. So they go through additional training after their dentistry, because what happens is sometimes patients' teeth are so bad, so they have like a root canal, that the dentist actually has to take out the tooth or extract the tooth. So then there's a big gap in their gum, okay? So this metal on the left-hand side that you see here, I can't point to the arrow, that is an implant, a dental implant that's going to go in the patient's mouth so that they will have a place to be able to chew food and more easily talk in the future. So the prosthodontists are very, very instrumental in helping people lead healthier lives for healthy eating habits. So what other healthcare workers can we talk about? Social workers are so important to support the everyday needs of the patient. I had a patient recently in the hospital that the 12-month-old baby had really bad tuberculosis, and we had to get special medicines from Germany under investigation to be able to treat him. And one of the issues was we needed to be able to get special laboratory tests done on an outpatient when they leave the hospital. And so that social worker was very, very helpful in helping us get that done for our patient and making sure that continuity of care was done. So that's just one very, very small example of interacting with social workers. They also will help us in the hospital for very, very sick patients. Sometimes several different physicians are seeing the patient. We may have a cancer doctor, we may have an infectious disease doctor, and also a heart doctor, all seeing the patient and having their recommendations. And so sometimes the social worker will also help us get the family meeting together. So all the different physicians will meet with the family to discuss what might be the next steps for the patient. So they are very instrumental in helping us out with that. What about beyond social work and physician, dentistry, and nursing? So beyond that, there are some healthcare workers that don't necessarily do the medicines or things of that nature, but they have to know about it. It's occupational therapy and physical therapy. They help with the everyday living activities. So let's start off with occupational therapy. So did any of you guys go to Oshkosh about 6 years ago for Pathfinder Camporee? Anyone? I don't see any hands raised. Oh, good. Okay, so okay. So my mother was on her way to Oshkosh from Andrews University, and she had a stroke. And she was so close to Chicago, Illinois, which there's Hinsdale Hospital, it's an Adventist hospital in Chicago. So God got her to get there and still be able to treat her stroke on her way to Oshkosh. So she didn't make it to Oshkosh Camporee, but she at least made it to the hospital. And my siblings and I, we went and made sure we were always at her bedside. And we are so grateful and thankful that the occupational therapists and the physical therapists were there to help her out, to reteach her how to use basic skills, because she could not see on the right-hand side of her face. Everything was dark. So they need to teach her how to maneuver everything with her left hand, even though she was not a left-handed person. So her right side was very, very weak. So occupational therapists taught her simple things: how to take a shower, how to bathe herself, and use her left hand to be able to do all those what we call activities of daily living. A lot of self-care needs. So they were very impactful on making her hands stronger and stronger over time. The physical therapist also was helpful. They helped her learn how to walk again. She had to start off walking with a walker, and then she eventually walks with a cane. So she still needs support, but she has to always use her left hand because she's stronger that way. So the physical therapists help with the larger bone movements to help with that kind of facility. I actually have a partial tear in my left shoulder. This goes back a couple years ago. So I myself had to have physical therapy. So one of the physical therapy exercises they taught me was to strengthen my posture. I'm still working on it. But then they also gave me these resistance bands. Okay, they come in all sorts of colors. And the different colors are different weights to help your muscles and your overall strength to get better. So one of the exercises they taught me to strengthen my posture was just to hold this strip out for about 30 seconds. I'm not going to do it for that long, but I'll give you an example. I had to make sure my shoulders were down, and then my posture was back. I mean, I had to focus a lot. I wasn't really doing the best form just now, but just to give you an idea, that I would do these exercises holding it out for about 30 seconds at a time, and then as I get stronger, I would do it for 60 seconds. And then when I got comfortable with doing this over time, then I would change the color of the band so my shoulders could get stronger. And that's just one example of one exercise that the physical therapist taught me. So now moving to my passion and Dr. Lola's passion, pharmacists. So pharmacists, we are the guardians of medications. We want to make sure that everything we do for the patient, it's safe and effective. We want to make sure that there's no major drug interactions. And what does that even mean? Sometimes when the patient takes two medicines together, it might actually cause one of the medications in the body to go really, really high, the levels in the body to go super, super high. That's not safe. So pharmacists will help the physicians make sure that if there is a drug interaction, we will reach out to the physician and maybe make a recommendation for a dosage change to make sure that both of the medicines are working well in the body. We do a lot of education on how to take some complex medications. And pharmacists can work in the community hospital, the hospital setting, or various other areas. So I'm going to show you some examples of pretend medications. These are Skittles candy, okay? So we're going to pretend these are medications, all right? Normally, anytime a pharmacist handles medicines, we would wash our hands and also wear gloves. So since this is just demonstration, I'm skipping those steps, okay? But sometimes patients have a hard time remembering how to take their medicines. So we will sometimes fill, this is a simple pill box where each of these boxes is Sunday, Monday, Tuesday, Wednesday, etc. One day of the week. And so we will put the medicines in the box if they're only taking a medicine once a day or so forth. Some medicine pill boxes have 4 slots for each day. So it just depends on how many medicines the patients are getting. But I will pretend to fill one day's of pill box, for example. Here is a red quote-unquote pill, okay? So we'll pretend that they're taking 2 pills a day. So we'll put in 2 in there. I dropped it. We would throw the one on the floor away. We would not give that to the patient, okay? And then let's pretend that this purple pill, they only take 1 tablet a day. So I put 1 purple pill in here so far, and then we'll pretend this yellow pill, they take 2. So now, instead of having to open 3 different pill bottles, medication bottles, they now have to just go to this one box and take all the medicines out for that one particular time in the day. And every single one of these would be filled out a week at a time. So I actually do this for my mom because she had a stroke. So I fill a whole week's worth at a time. I actually do 2 or 3 weeks worth at a time so that we never run out of medicines for her. So these are pill form for medicines. Now I work in the pediatric setting, so I work with little kids. And obviously little kids can't always swallow pills. So they need to get liquid medicine. So this is just water in here. So the medicine comes in the bottle, for example, and we have to pull medicine using these oral syringes. So by mouth, oral means by mouth, and we will measure the right dose to give to the patient so that when the nurse gets the medicine on the floor, they double check if we measure it correctly, because everything is labeled, and then they give it to the patient. So I'll give you an example of how we pull this up. I'm removing this safety cap first. We want to make sure that little kids don't get into the medicines. This is an adapter, okay, because it'll be easier for us to measure out the medication. So I lift this up. So now there's a hole over here that I can pull the medicine out. So now I just pulled 4 mLs out of here. That's almost 1 teaspoon for the patient, if that was the dose. And this little orange cap on top, we always put that on there before we give it to the nurse, so that when we're dispensing it, it's a closed system, and it stays as clean as possible before they would need to give it to the patient. if they were going home and they needed the oral syringe, we do not dispense the oral caps, this tip, this thing, because it's a choking hazard. They would only get this part, okay? So that's an example of what we do in pediatric therapy. So beyond the dispensing part of pharmacy, there's also a lot of different specialties. One of the specialty pharmacies in the United States, actually there's several, but this is one example, where some disease states are so rare. This particular example is Attruby is the brand name, and it's for amyloid cardiomyopathy. So that's a very rare disorder where the heart is an enlarged size, and it's a thick, their heart has a thickened wall so that the patient's heart is not going to function as well, and they need this special medicine. In the United States, this costs $804 per day. So imagine $293,000 a year for this particular medication. Most people can't afford this. So these specialty pharmacies work with the physicians and the insurance plans and maybe even the pharmaceutical company to try to see, is there a way to be able to give this medicine for the patient so that they can live a longer life with this very, very rare disorder. So there are specialty pharmacies with other drugs. I actually got a specialty tuberculosis medication for that same patient from a specialty pharmacy from Tennessee. The drug was called Bedaquiline. So that's the only place in the entire United States that we can get that particular medication. So specialty pharmacies are very helpful in dealing with very unique medication products. And then there are clinical pharmacists and then clinical pharmacy specialists. Dr. Lola, in her East Coast experience, was an internal medicine pharmacy specialist, and then I am a pediatric infectious disease pharmacy specialist. And we often will conduct patient rounds with the healthcare provider, where here you can see I am speaking with my infectious disease physician and my pharmacy resident. And we're making recommendations on rounds. We do a lot of similar things as far as making sure the doses are appropriate, no drug interactions, as with any pharmacist. But we're a little bit more present on face-to-face time with the physician. And on the right-hand side of this slide, you can see that there's ICU, so critical care pharmacy, there's cancer pharmacy, there's transplant, so if they have a heart transplant, a kidney transplant, and so forth. Sometimes patients are on blood thinners, so they help manage some of the medicines that help thin the blood. And then in emergency medicine, and in my area, infectious disease. So I just wanted to touch a little bit about what I do at Loma Linda University Children's Hospital. I am the co-director, along with my physician, Dr. Alvaro Galvez, for the Antimicrobial Stewardship Program. So what is antimicrobial stewardship and what does this entail? It's a multidisciplinary team, meaning it's not just me alone. Now, the core team is Dr. Galvez and myself, but we heavily rely on every entity that's listed on this slide. The first thing we need is we need hospital administration support, all the way at the top of the decision-making for that hospital. Without their support, we cannot function as efficiently as if we did not have their support. So leadership is important. We work with our epidemiologists because of the importance of antibiotic resistance. We work with our nurses, our pharmacists that are on the floors, and other infectious disease and medical practitioners. And then we obviously need the laboratory, medical technologists, to help do the lab work and tell us what is going on from a lab perspective. And then we heavily rely on computers if that's possible. I know that it may not always be possible to have all the computer access, but there's still a way to do antimicrobial stewardship in simple ways. So what do these numbers mean? 35,900 and just over 2.8 million. These are staggering numbers that we do not like to see in the United States or the world. And essentially, this is the threat of antibiotic resistance in the United States. So we, on an annual basis, see about 2.8 million infections that their infection is resistant to multiple antibiotics that are even available to be able to give them. And some of that leads to death because we don't have any good options. So that is one reason why we do antimicrobial stewardship. We want to make sure that everything is right for the patient. From a nursing and pharmacy perspective, they always learn the 5 medication rights. You want to make sure you're giving the medicine to the right patient. Is it the right drug? Is it the right dose? Is it the right timing? And also, is it the right route? Are you giving it by vein or you're giving it by mouth? So with antimicrobial stewardship, we have 5 Ds. We also have right drug. We have correct dose. But we also have timely de-escalation, suitable duration, and also the right drug and route. So one of the things I do on a daily basis when I'm at the hospital is an intervention called prospective audit and feedback. So the pharmacy students have seen this PPCP model a lot. You have it memorized in your brain and so forth. This is the pharmacist patient care process where, in every discipline, we all do this, right? Anytime we are assessing a patient, even in research, we are collecting some kind of information. Then we're assessing that information that we collect. We plan on what we want to do with that information. And then if there's any changes that we want to do, we implement that recommendation. And then we follow up. Did that recommendation work for the patient or did it not? Do we need to make any changes? So this cycle comes every single day as we reevaluate the patient on how they're doing from day to day. On the right-hand side of this slide, I have access to a software system that will tell me all the positive culture results in my hospital, so I don't have to go looking for them. So electronically, it tells me, oh, these 5 patients have a positive respiratory or sputum culture, or these 3 patients have a positive blood culture, and so forth. So I know how to prioritize my time by looking at and all of these what we call alerts. So this is the first thing I do every single morning is I prioritize my high priority alerts and I will review them with my physician as needed, and then we will go speak to the team if we have any recommendations. This is an example of what all of our pharmacists do 24 hours a day, 7 days a week. So we are very fortunate that anytime a patient's blood culture, so if they're really, really sick and the physician orders a blood sample, if that blood sample has bacteria in there, the lab will run a rapid diagnostic test. What that means is normally that test would have identified a bacteria name in 48 to 72 hours. This rapid test will tell us the answer in about 3 to 4 hours. So the pharmacists get called on this special test, and the pharmacist will then evaluate the protocol and reach out to the physician to make sure that the patient is getting the right antibiotic much more quickly than traditional microbiological measures. And we write a note in the chart so that the physician sees what our recommendations were. So what is my typical day? Generally, I spend about 75 to 85% in patient care, where I will look at all those flag alerts that I showed you, and then I will also round with the infectious disease consult service. So that pretty much occupies a lot of my day. The other 5 to 10% is administrative duties, where if I have time in the course of the day, I'll do a quality improvement project. I oversee a lot of projects for my pharmacy residents, and I'll go to committees. And then about 10 to 20% with teaching students, pharmacy residents, and also I'm here as a resource for my pharmacists for any questions that may have when they get calls from their physicians that they need additional input. So my career path to get to where I'm at, it did take several years to be able to get on this trajectory, but I did get my Doctor of Pharmacy degree, and then in the United States, we do pharmacy residencies if we want to practice in the hospital environment or more clinical role. So I spent 1 year doing a residency, we call it PGY1, so postgraduate year 1 residency, and then I specialized in infectious diseases another year. And then at the University of Pennsylvania, I stayed on a 3rd year, and I did clinical research and HIV research with, for the AIDS patients. And then I ultimately practiced as a clinical pharmacy specialist in both adult and in pediatric infectious diseases for several years, and now am also in the co-director's antimicrobial stewardship role. So with all of these career journeys that I've had, and with any of these disciplines, I have my 5P approach that I do both in my personal and my professional life, because I've seen that it really has helped my trajectory with interacting with others. So first P is patience. A lot of these protocols take time, and the persistence is there because one protocol that I implemented, it took 7 years to actually implement my stewardship program in the East Coast. And it was well worth it. I just kept being persistent and pushing on and reaching out to my hospital leadership, and eventually they supported the program. So with that, I needed to have a positive attitude because that can be very, very contagious to influence others. So with a positive attitude, that can go a long way in getting what you want to do done. And of course, we need prayer throughout our life because without God, we cannot do anything. And then the 5th P is Proverbs 3:5-6. Trust in the Lord with all your heart and lean not on your own understanding, but in all your ways submit to him and he will keep your paths straight. My path has sometimes gone in crooked journeys over time, but he always led me back to my path and always to remember God. So your journey can start here. What's next for you? What do you think your superpower is? Some of you already have begun your journey, right, with your where you want to go. Some of you may be thinking about where you want to go. I would have you talk to a healthcare professional that you might know. If there's any possibility, volunteer if you think at a hospital or a clinic if you think you might like that particular career path. Explore school clubs if they exist, and then look online. There are several different career options online. And then you do want to have a decent science and math experience focus, because there's a lot of math, at least especially from pharmacy standpoint, but definitely nursing, pharmacy technician, physician, you need math and science. So overall, just pray to God and think about what is your calling. Is God calling you to go into the healthcare field? I have the QR code there if you're interested, or have to scan to the LOU, because essentially I've only covered just a very small portion of all the different kinds of healthcare fields that are available. And you can go and get some more ideas on Loma Linda's website. So thank you, and we'll move on to the Q&A session.
We are so thankful for our two doctors here, Dr. Tim and Dr. Noreen, for their beautiful and meaningful insight that they shared to us this afternoon. Now we are going to have our question and answer. So if you have some question, please please ask. Kasi nandito pa sila. Mamaya wala na sila. So, magtulungan na kayo kung kayo ay nahihiya. So, please stop your classmate kung sila ang magsasabi ng question. So, Dr. Tim, talk about the significance of our mental health, which is also our, as a student, kung ano man yung ating, whatever our role, mental health is a very important factor in our lives. So, if you have some question, if you have some concern about your mental health, please ask. And also for Dr. Noreen, if in the future you want to be a doctor, so this afternoon, we learned that yung doctor, hindi lang pala nagtuturo, sayang. Kung alam ko lang, meron din palang physical therapist, no? Ayaw ko kasi mag-doctor kasi takot ako sa dugo. So meron din palang ibang, there is also a doctor who is not, I'm taking injection because I'm afraid of injection. So there are a lot of doctors. So that is a big help to our grade 12 students. Sa mga college, sige, patuloy nyo na yung career nyo. Pero sa mga grade 12, sa mga STEM, yon, that is your time to choose your career. So there are a lot of occupation that is related to medicine. Marami kayong pagpipilian, sinabi ni Doc. So ayan. I hope that yung time ko na yon, nakapag-isip na kayo doon if you have questions. So they are ready to answer your questions, so please ask. We will accommodate 2 to 3 questions only. 2 to 3 questions. Ma'am Pa asks a question. Please give her the microphone.
My question is for Dr. Kim. Who are more prone to mental health problems? Those who have high IQ or those who have low IQ?
Can you hear me? Oh, okay. So just to repeat her question, she's asking who are those who are prone to mental health issues or disorders, those with high IQs or those with low IQs. So from what I read, it's really more people with low health literacy. So not a lot of studies has gone into whether you have high IQ or low IQ, but more instead if you have a high literacy as it deals with mental health. So if you don't have that understanding, you're more prone to more health issues. So, but when you have more understanding, you get more information about it, then you're able to make more healthy decisions and make more clinical decisions to be able to help with your mental health. So I hope that answers your question a little bit.
I have another question. Those who have experienced trauma and then it turned into a mental health problem or psychiatric problem. I heard that if that person will be exposed to the trauma that she had experienced, it will help him or her heal. Is that true? Again, those who have severe trauma, like that person saw a shocking image, and then it turned into a psychiatric problem. Is it true that if that person will be exposed again to that same trauma that she had experienced, will that help him or her return to her normal self?
Okay, that's a very good question. I am not a psychiatrist or a doctor, so I will not say neither yes or no. And it's a very loaded question in the sense that there are two. Oh, okay. Does he have somewhat of an answer? While he comes up, what I do know that there is a dual answer to that kind of question. There are some that cannot handle seeing that same experience or experiencing the same thing again, and that can cause triggers for that person. So that I know for sure, but we do have someone who is a social worker, so he can better answer that for you.
Thank you, doctor. Thank you, doctor.
So he's going to introduce himself. Introduce yourself.
Hey, how you doing? My name is Sam. I'm a social worker, so I specialize in mental health. I usually work with kids, but so pretty much what you're talking about was re-exposure to the same trauma, if that's what you're asking. So re-exposure does not make you stronger, if that's what you're asking. So if I'm understanding the question correctly, is that somebody's going to experience the same trauma they experienced before that caused them the mental health problems, the psychiatric responses to something that you're talking about here. So the simple answer is no, if that answers your question. So again, that's why some people, and then also this is maybe like a cultural norm or maybe like a family norm, because a lot of people, they tend to do this. They say, let this person experience the same thing again so they could be stronger. That's not how it works in mental health. So just want to keep that in mind. But also the last question that you had when it comes to, I believe it was an IQ, the correlation between IQ and mental health. Yeah. So mental health affects everybody. And then just like Dr. Lola said though, the more you understand something, the easier it is for you to combat it, easier for you to understand it, easier for you to treat yourself. Just like when we learn coping skills, right? If something stresses you out, like say doing homework stresses you out, like one of the kids in the back, they say, oh man, I don't want to do homework, like I'm super stressed, right? But if they learn good coping skills, they understand themselves better, right? They learn stuff from the books, then they're getting better. So to answer your question from the last one, mental health affects everybody, but understanding of mental health conditions and coping skills and healthy coping skills is what makes you stronger mentally. Yeah.
Thank you.
Hopefully that's not too long.
Stay. You might as well stay. Stay up. Yes. Any other questions?
I have two simple questions, and they are all about mental health. Is it true, Dr. Tamilola, is it true that the gap between sanity and insanity is just very thin?
Can you say that again? I'm sorry.
Did I make myself clear? The borderline, the gap between sanity and insanity is just very thin.
Okay, he's saying that is the gap between sanity and insanity a very thin line? I can say yes.
So
it can be a very
if that's
thin
true,
line.
what would you advise us? What to advise us to do, especially we teachers? No, if it's true that it's paper thin, you can never tell. A person may be okay now, but you don't know. Okay, so for us teachers, what should we do?
I understand what you're saying. So it does work. I understand what you're saying. So Dr. Lola is saying the line is thin, right? Just like love and hate, it's a thin line. But right, insanity, sanity, you can make a decision right now. If somebody like do something to you and you say, you know what, instead of me walking away, I'm gonna confront this person. But again, just going back to what Dr. Lola said, literacy, understanding, like this is like comes down to basic human understanding of how to be a person, right? Do you walk away from everything? Do you just say, I wanna fight everybody? So I think that's the line that she's talking about here, is that it could be a thin line, also could be a very thick line, right? So everything is conscious decisions.
So we have to be very careful, be caring, and
Yeah.
okay.
About too, in terms of coping mechanisms, right? So one person can be exposed to one thing and handle it differently, while somebody else can be exposed to the same exact situation and handle it in a totally different way.
We cannot make general conclusions
Exactly.
then.
So what I discussed in the presentation in terms of how you're raised, your values, your thought processes, all those affect the daily decisions that you make towards positive mental health and also negative mental health. So while it can be a thin line, we have decisions that we make on a daily basis to push us in one direction or the other.
Thank you. My second question is, you are the experts. You are from Loma Linda University. We all know what happened a few years back when the whole world was shaken by that virus. Mentally, did you conduct studies in the university studying the trend? What happened after the pandemic? Was there an increase in anxiety, depression because of what happened? Because I have one related question. It seems that there was a rise, resulting even to, there are kids, there are lots of factors, ending their lives because of stress, because of anxiety. But are those related to what happened after the pandemic? Pandemic. When people's minds were affected. Yeah. Well, I don't know if...
I can try to repeat what you just said.
Yeah.
What I'm understanding from your question is, post-pandemic, were there any studies that were done?
Correct. That's
Yes, post-pandemic.
Post-pandemic.
Yes. Were there any studies that were done at Loma Linda University regarding anxiety or regarding any mental health disorders post-pandemic?
Pandemic.
Not that I know of. I'm sure there were done globally. However, I don't know if any were done specifically at Loma Linda in regards to anxiety or depression or anything of that nature. So I would have to look into that. I'm not too sure about that.
Okay, thank you.
Yeah, so some of the studies, my understanding is that at Loma Linda, some of the studies are done, they're more specific. So they will maybe work on kids or veterans during COVID and how they respond to being locked down, being isolated, rather than overall generalized. Yeah, that's something I don't understand. Yeah.
Yeah, I don't know either, but we do have a school of behavioral health that if you wanted to, go online and reach out to them and ask them, that could be an option too. From a clinical perspective, I have collaborated on post-COVID, or actually during COVID pandemic, some disease states with my critical care physicians as well as my infectious disease physicians. We were seeing a lot of multi-system inflammatory syndrome in children. We call it MIS-C or MIS-C, and really, really bad inflammation. And so we looked at our own patients and did some research from that perspective.
Are phobias included in the mental health problem? Phobias. Phobia.
Oh, phobia.
Phobias.
So if
Because I knew of some who has severe phobia. Just a picture of a snake.
Phobia.
Oh, they scream.
I am afraid of is phobia. Blood.
So
that
just to repeat her
included?
question, she's asking if phobias are part of mental health disorders. Phobias are just like fears of, it can be anything. So being claustrophobic, fear of heights, fear of all these things. I do know that these kind of fears are affecting the mental, your brain, the way it works, because a lot of these things are not actual physical things that normally will cause fear for others, but for whatever reason, for that individual, because of maybe a situation that has happened to them. Take, for example, I'm scared of dogs and cats. And for some, they've had a traumatic experience that have occurred because of that. So to answer your question, I would have to look into that. I'm not sure if phobia is a part of the list of mental disorders, but I definitely, a traumatic event is part of that list.
Yeah, so, I don't know if she's listening. But when it comes to phobias, right, a lot of times there are things that you're born with. Like as a kid, I was scared of the dark. I think a lot of kids are probably scared of the dark as kids. That's not a mental health condition. But as an adult, as somebody, like say, some of the people I served in the military with, they have PTSD, right? Because loud sounds trigger them. So that could be a phobia in the beginning, right? You could say that's PTSD, but it depends on how the phobia affects your everyday life. So if you can't go to sleep, if you hear a loud sound that triggers you, makes you go insane, gives you crazy anxiety, then that's PTSD, right? So that phobia has transitioned into anxiety and also transitioned into PTSD, post-traumatic stress disorder, then that's a mental health condition, right? A disease. That's something that can be diagnosed. So just phobia by itself, it doesn't count. But what phobia does to you as your daily life, how much you sleep, how much you eat, how much you don't eat, right? How much you want to spend time with other people, how good you are when it comes to communicating with other people, or how bad you are when it comes to communicating with people, right? If somebody cuts you off on the road, are you going to throw a fit? Are you trying to jump out of your car and get a fight? Or you be like, it's okay, I'm going to drive away, right? So how it affects you on a daily basis, that's what determines if phobia can be a mental health condition. Thank you.
Hello. We have two questions here. First, a friend of mine acknowledges that she has
No idea.
mental health problems, but is afraid to seek help
So sorry.
because of the stigma and the fear of finding out that she really does have a problem. How can I help her, or how can I motivate her to seek help? And the second one, I think it's related. How can you tell if you have a mental health
So let me try to
sorry.
repeat your question. I heard some of it. He said that there's a friend who has a mental health disorder but is afraid to seek help because of the stigma associated with this mental health disorder. You didn't specify, but I'm just going to talk about it broadly. He's asking, how can I encourage this friend to seek help? I didn't hear the second part of the question. What was the part two?
The second question is that, how can you tell if you have a mental health disorder or problem? Can you recognize it yourself, or do others usually notice it first?
Okay.
And based on the scenario, what should be done next?
I'll take the first.
I don't have no idea what he said. I'm going to look at the question.
Oh, okay. So while he's looking at the other part, I'll discuss the first part. So a lot of people have stigma with mental health disorder.
Oh, this?
As to if I come out with it, I'm going to be ostracized. My friends, I will lose my friends. People will look at me a certain way, and I won't be able to fit into community as I should. The best way, I think, to encourage your friend is to point them to people that can help. And I spoke a little bit about some of the leaders. So it can be a pastor, it can be a healthcare professional. I'm not sure what's available here in the Philippines, but there are different programs that help people that are dealing with mental health disorders. So we talked about the peer support programs. We talked about seeking out to see a doctor. So all these things can help. However, it's understanding and knowing what is available in your country, which I'm not too clear about. So maybe going online and seeing, are there, I don't know what the friend has, but if it's depression, are there programs out there that help people with depression? Can they talk to their doctor? So all these things are ways that you can help that person to seek help. Understanding that it's better to seek help than to try to do it on their own. So always better to encourage that person to seek help. And then, did you hear the second part? Okay.
Yeah.
Okay. Oh, that was fine.
So.
How can you tell if you have a mental health disorder? Can you recognize it yourself? Or do others usually notice it first? Very good question.
Yeah, so step one, right? You got to combat the stigma. right? The stigma is pretty much saying, I don't have a mental health problem, because if I do have a mental health problem, that means I'm crazy. That means I'm not faithful. That means I'm not a good Christian, right? I think this is kind of like when it comes to the basis, this is a challenge. This is the debate between faith and science, right? But as a mental health professional, as somebody who was trained in this field for the past 2 years, I have a degree in it, I want to say that I can go to prayer, I can go to my pastor, I can pray for others, but at the end of the day, if, just like what I told the lady in the back, if this is something that's affecting my sleep, how I eat, how I hang out with my friends and my family, then it is more than just prayer. Then I need actual medication. Just like the doctors here, when they talk about medications, these medicines are made for a reason. They're not made to make money. That's part of it, but a big part of it is actually help us, right? So what I want to say to your friend, or the example that you just gave me, because you just said, I'm asking for a friend, right? So tell your friend saying, are you having a hard time waking up? Are you having a hard time spending time with your friends? If you do, I'll pray for you, because I know God will be there for both of us. But at the same time, I'll pray for you to go see someone who could deal with this professionally. Because there's faith, there's spirituality, but there's also medicine. So I think part of it is I trust God, but also trust medicine and trust science. Yeah.
Thank you po.
And let's not have a debate about God and science, please.
It's similar to what he just said. There's another question, which somewhat answered it, but I'll just repeat the question again. How do we strike the balance between spiritual and psychological intervention? Because sometimes we tend to spiritualize mental health problem, like just pray about it. You lack faith, trust God. Although this is important, when is it the right time that it can be applicable, and when is it helpful? So just to piggyback on what Sam said, yes, prayer is important. Understanding that mental health is not just feelings, right? There are times when it's actually chemical imbalances. There are times when there are actually things going on in the brain that you cannot see. So, in essence, you need to seek medical treatment and also psychological treatment, all right? Like he said, it's when it affects your daily life. You're not able to sleep. You're not able to go to work. You're not able to participate in the things that you used to enjoy. It affects every part of your life, and you're not able to live a good life and have that positive mental health. So in essence, yes, combine everything with prayer. There's always room for prayer, but there's also room to ask to get professional help as well. They can all work together, and they can all be treatment modalities that can be used together.
Okay, so this is one, please correct me, all the pharmacists and nursing students. All right, I'm going to use potassium as an example here. When potassium levels are low, right, we kind of all know what potassium is, I'm hoping. If your potassium levels are low, there's something that happens to you. Catatonia, that's what happens, right? You're kind of sitting back, you look like you don't want to do anything. That's a medical term, well, not a medical term, but that's a term we could use. So when your potassium levels are low, the normal is 3.5 to 5. Depends on where you go, the numbers are different. If your potassium levels are low, you could be sitting on the couch or on the bench, you look like you can't move. So can I just pray for that person and thinking everything will be okay? I'm pretty sure the answer is no. Then, or I could give this person some bananas and force them to eat some bananas. Then the potassium levels will go back up, right? I could pray for the person. I could say, hope everything gets better for you. But at the same time, I got to recognize there's a chemical imbalance. I can't just say, I'm going to pray to you, pray for you, and things will get better. I got to be realistic. I got to give you medication. So again, it goes back to the same thing I keep repeating right now. Use faith to guide you in your pursuit of greatness, of you actualizing what you want to be in life and how to help others. Use that to guide you as your mission and all that. But at the same time, recognizing the science is there. To not discard everything that you're learning from school. To not look away from the hard sciences that maybe sometimes challenges your faith. I think for all of us here, especially coming from Loma Linda, there's a fine balance. Just like what Dr. Here asked, right? There's a thin line here between sanity and insanity. Just like us, when it comes to religion, when it comes to faith, when it comes to everything we learn in school. You got to be able to recognize that. You got to make critical, clinical judgments, right? So please keep that in mind when you ask these, well, not ask these questions, but when you carry on with your daily lives. In the future, no matter what career fields you go into, also recognizing your mental health. Because there's a lot that we're dealing with on a daily basis. Just us coming here for 5 days, we could see some of the challenges, some things that we could help starting tomorrow. So this is something that we want to help. But at the same time, we will pray for you. Our sessions will probably start with a prayer. I'll hold your hand, I'll give you a prayer. But at the same time, just like we have pharmacy here. We bought a lot of medication to help people. We're not going to hold back to it just because we prayed for you. We're still going to give it to you. We're still going to use your brains and then everything we learn or experience to know that what you need. Sorry, that was a little long answer.
Thank you so much, dear doctors. And shall we give them a round of applause for sharing meaningful insight and for answering our question this afternoon, and especially to our visitors from Loma Linda University. So on behalf of the AY department, we would like to thank you all for attending our afternoon worship this afternoon. To our brethren, to our teachers, and especially to our visitors from Loma Linda University. May God bless you in your ministry. We are so thankful and blessed that you are here with us this afternoon. To close our afternoon worship this afternoon, we are going to sing a song that will remind us that we are not alone. There is someone who is willing to listen to us and who always love us no matter what. We're going to sing hymn number 485, I Must Tell Jesus. Hymn number 485, I Must Tell Jesus, for our closing song. And may I request the pianist to accompany us. Shall we all stand? I cannot bear the burdens Richard Gonzalez will give the closing prayer.
I ask you to bow your head and pray with me. Dear Father, thank you so much for the wonderful weather that you have brought. Thank you for the rain. Thank you for the time that we were able to spend with you to learn more about mental health issues and different careers in the healthcare. My request this evening is so that you can be with each of the students here, that you can spark an interest in them, so that they may be the salt of the earth and they can go to their communities and supply the needs, whether it's a physical, whether it's a mental, whatever it is, Father, that you may be able to let them be that light, that salt that the earth needs. As we depart, please be with everyone in this building and those who are not here. And thank you for everything that you've done for us. In the name of Jesus, I pray. Amen.
Please stay by because the religious